Good afternoon, and thank you for joining us again. I will start with the usual update on today's statistics. The total number of positive cases reported yesterday was 830. That represents 5.2% of the total number of tests and takes the total number of confirmed cases in Scotland to 190,005. 257 of those new cases were in Greater Glasgow and Clyde, 133 in Lanarkshire, 119 in Ayrshire and Arran, and 100 in Lothian. The remaining cases were spread across 9 other health board areas. 1,472 people are currently in hospital. That is 27 less than yesterday. 115 people are in intensive care who have tested positive for COVID or been admitted to hospital with COVID within the last 28 days, and that is 6 more than yesterday. 30 people have been in intensive care with COVID for longer than 28 days, which is 2 more than yesterday. And I'm very sorry to report that 67 additional deaths have been registered in the last 24 hours of a patient who first tested positive over the previous 28 days. That means that the total number of deaths under this daily measurement is now 6,666. And of course, as always, behind those numbers are families and loved ones and friends who are grieving. Every life lost during this pandemic has been a source of grief and heartbreak to many. So I once again want to send my condolences to all of those who've lost a loved one. I'm joined today by our National Clinical Director, Professor Jason Leitch, who will help me answer questions shortly. Before that, though, there are 3 issues I want to focus on. The first is about the progress in our vaccination programme. As at 8:30 this morning, 1,113,628 people in Scotland have received their first dose of the vaccine. That is an increase of 64,881 since yesterday, the highest reported increase since the vaccination programme commenced in December. I can't at this point give you detailed percentages for each of the groups covered and how well the vaccination teams are doing, although clearly from that number of 64,881, they are doing exceptionally well. A technical issue with the data from the GPIT system, one of 2 systems that feeds into those numbers we report, has delayed that calculation. But that calculation will be on the Scottish Government's website at 2 o'clock today. So we remain on course to give first doses to all 70 to 79-year-olds and those with a serious clinical vulnerability by the 15th of February. After that, subject to supply, we intend to give first doses of the vaccine to all 65 to 69-year-olds by the end of February, the beginning of March. And we continue to plan for everyone over the age of 50 to have received their first dose in May. However, I have to emphasise again, of course, that all of this is subject to supply. The uptake we've seen so far has been both remarkable and very welcome. But as the First Minister indicated yesterday, a combination of circumstances, remarkably high uptake, a temporary reduction in supply from Pfizer, and the need to ensure people can receive second doses on time means that we need to reduce the number of appointments we schedule over the next few weeks. As soon as supply improves, our programme will scale up again, as we have shown that it can, and we remain on target to meet those targets. So I want to take this opportunity to thank everyone who has made that possible. That includes everyone who is helping to deliver the vaccination programme, our vaccination teams, support staff, our local authority and voluntary sector partners and the armed forces, and importantly, everyone who is turning up to receive the first dose. My second update is about an announcement that has been made today regarding dental students. This morning, students in their final year of dentistry learned that they will not be able to graduate this summer. Instead, most final year students and all dental year students in other year groups will have to repeat the academic year. This difficult decision has been made on the recommendation of Scotland's dental schools. They advise that, over the past year, students have not been able to gain sufficient clinical experience because of the restrictions on dental procedures. Today's decision is not one that any of us wanted to take, and I do understand how incredibly disappointing it will be for dental students across the country. After all your hard work and through no fault of your own, you're having to deal with a very difficult setback, one which will inevitably create significant challenges for you. The Scottish Government is, of course, determined to support you through these challenges as much as we can. That's why I can confirm that we will provide extra bursaries for dental students who are required to repeat a year. These bursaries will be worth the equivalent of your student loan award, which could be up to £6,750. Your dental school will be able to provide further information on the bursaries as well as other help that is available. Today's decision is a really tough one. I don't underestimate that for 1 minute. But it is about giving dental students the experience which has been denied them this year because of the pandemic. We need to ensure that people studying dentistry can enter the profession as confident, fully qualified clinicians. And so we're providing extra support in order to give them the means and the encouragement that they need to complete their studies. My final point that I want to cover today concerns funerals. The restrictions we've placed on funeral attendance mean that a maximum of 20 people can go to funeral services. Those restrictions are among the most difficult that we've had to put in place, and I know that they cause distress to people who are already grieving. But the restrictions are vital, and any gathering creates a risk that the virus will be transmitted. And unfortunately, that risk is even greater when it comes to funerals, where inevitably and understandably, at such an emotional event, people are likely to want to hug and hold each other or simply to be in close proximity to each other. We're currently receiving reports about funeral services where more than 20 people are in attendance. And so I want to remind people that that limit of 20 is still in place and that unfortunately it is there for a really good reason. So please, if you're arranging a funeral, think about the restrictions when you're sending out invitations and when you're telling people about the event on social media. If you would like to go to a funeral service but cannot go because of the 20-person limit, then please respect that fact. Maybe find out if it's possible to see the service by other means, such as live streaming, and check with the person organising about the other ways in which you can pay your respects. But please don't simply turn up. This places the organisers in a terrible position. And it also, of course, increases the risk that the virus will spread as a result of the event. And I know that you don't want that. More information about the rules for funerals is available on the Scottish Government website. For now, I want to thank all of the people who work to arrange funerals and funeral services. We hugely appreciate the contribution you are making to ensure that these events are as fitting and also as safe as possible. And finally, I want to thank everyone who follows the guidance when attending funerals. As I said at the start, I know how difficult these restrictions are, and I regret very much that they are necessary. But they are necessary, so please do stick to them for the time being. Those were the main issues I wanted to cover today. To close, I want to remind everyone once again of the current rules and guidelines. The most important rule at the moment, of course, is very clear. You should stay at home. In any level 4 area, and of course that includes all of mainland Scotland, you must only leave the house for essential purposes. Those include caring responsibilities, essential shopping, and exercise. If you do meet up with someone outdoors, you can only meet with one other person from one other household. You should work from home if you possibly can, and employers have a legal duty to support people to work from home. And please download the Protect Scotland app if it's possible. On any occasion, when you do leave the house, please remember facts. Wear face coverings when you're doing essential shopping or out. Avoid anywhere busy. Clean hands and surfaces. Use 2-metre distancing if you're talking to someone from another household. And self-isolate and book a test if you have symptoms. But above all else, please stay at home as much as possible. That continues to be our very best way of protecting ourselves, our loved ones, and our communities. And it is how we keep the virus under control while the vaccination programme does its work. So please, stay at home, protect the NHS, and save lives. And thank you once again to everyone who is doing that. Now let's turn to the journalists for their questions this morning. And the first is David Henderson from BBC.
Thanks very much indeed. The rules for hotel quarantine take effect on Monday, and they seem to allow people to leave their rooms repeatedly to get some fresh air or to have a smoke. Now, that raises the risk of COVID spreading to security guards, to hotel workers and the community, as happened in Australia. So there, residents of these hotels are now not allowed outside their rooms at all. Can you just clarify, what rules are you putting in place? Can you also tell us what COVID tests will be offered to hotel workers so they stay safe? Will there be daily tests like there are in Australia? And can you also clarify what measures will be in place to prevent Scots travellers simply flying into English airports and then travelling overland back into Scotland? It's an obvious loophole, so if the UK government won't close it, will you? Thanks very much, David. And for some of the points that you've raised, I'll ask Professor Leitch to make some comments. In terms of rules and tests, there is a UK-wide contract on the whole managed quarantine approach, which we are part of, and we continue to discuss with the UK government some of the detail around the practical implementation of that, which does, of course, include some of those rules that you mentioned. Those discussions are underway, they're currently going on, and as soon as we reach conclusions on any of those, then we will, of course, make sure that people know. In terms of tests, the tests for those in quarantine will be PCR tests, and they will be processed through, in Glasgow, through the Lighthouse Lab. Tests in terms of others who may be involved are, again, part of those discussions. And your point about in effect, the land border between Scotland and England is a point that has been raised with me and with others. We're very clear, our position as a Scottish Government about saying that no one from international travel should enter Scotland without being part of managed quarantine is driven by clinical advice, and it's driven by our experience last year, over the summer and subsequently. So we are very determined, as far as we can, to ensure that that view is followed. Now, we continue to discuss with the UK government because we think that their approach, which confines itself to the red zone areas, is insufficient. And we continue to work with them to try and persuade them that they should adopt the tougher stance that we are adopting. However, while we do that, we do have to give serious thought to the options that may be available to us for precisely the reason that you've outlined, and that many will enter the UK via the major airport hubs in London, Manchester and elsewhere, and will then travel to Scotland. So we need to work through with the UK government how that will be managed, how we will know that, and if there is a need for other measures at the border. Of course, that is an operational issue for our Chief Constable. He will be giving that some consideration, but the decision around that is and should remain with him. Jason.
You've covered it mostly, Cabinet Secretary. Let's remember the principle here is you shouldn't travel. So you shouldn't travel unless you absolutely have to. And when you come back to Scotland, these will be the new rules. We're not expecting, David, the way you asked the question, as if we're expecting people to abscond from self-isolation. This is supported isolation. It's to put in place meals, accommodation to allow people to safely quarantine before they go back to their families, their workplaces, or whatever else they do. We will allow people to behave like human beings. So people will go outdoors for fresh air. That will be part of the operational process. But we're not expecting there to be guards and fences around every hotel to keep people in. It's not that kind of image. It's about supporting people to isolate safely in a secure environment, of course. And the operational processes for that, the testing for the staff, how the meals will be delivered, which hotels it will be, that's being worked out even as we speak this week. We've done this very, very quickly, and it will be in place on Monday.
Thanks very much. Now we've got Ross Govans from Scottish Television.
Afternoon, Cabinet Secretary. On the quarantine hotels, when will you announce a full list of any exemptions? There has been concern, certainly in the oil and gas sector, about the movement of workers between countries. And just a quick one, if I may, on the vaccine rollout. You've said we may see reduced numbers in the coming weeks due to supply problems. Can you give us an idea just how much you expect numbers to fall on a daily basis, and what guarantees have you been given about any future supply problems?
So there is already, as you know, before the managed quarantine comes into play on Monday, there is an exemption list for issues around international travel. That exemption list is being reviewed as we speak. It has been part of the ongoing discussions, and where there are changes to that, then those will be announced very shortly, in order to make sure the whole point of all of this, of course, as Jason has said, is about protecting Scotland from the inward transmission of the virus. Now, there are some instances where people should be exempt from managed quarantine in the way that it's been described because of the nature of the job that they do, or in instances perhaps of health reasons or palliative care, for example. However, we're working through that exemption list, reviewing it against the stance that we are now taking, quite rightly, the tougher stance that we're now taking, and where there are changes to that, then we will make those public. In terms of the vaccine supply, our current estimate is that, so this week we have reached the 400,000 vaccinations in a week that we said we would reach at the end of February. We've done it sooner. And what that demonstrates is that the infrastructure, the capacity, the workforce, the delivery inside Scotland is ready and able to do that because we've done it. But the dip in supply that we anticipate means that we expect to be reducing that number to about somewhere between 150 and 200,000 vaccinations next week and the week after. That still allows us to meet the targets that we have set about completing all those in Group 5 by the end of February, the very beginning of March, and beginning to invite those in Group 6, which is the largest of the cohort groups. It covers many people, towards the end of this month. Now, if supplies were not dipping, we would have been inviting them earlier, but we can't do that. But we're not out of sync in all of this with the deployment plan that was published in January. It's just that we are not currently able for the next couple of weeks and possibly sometime around March to be able to go as fast as we clearly have been going, and we have the capacity to go as fast as that. In terms of forward supply, this is all around, we've touched on this before, this is all around the manufacturing process. And Pfizer said not that long ago that they would have to scale down their manufacture in order to scale it up to meet the global demand that exists for this vaccine. It's not just Scotland, it's the world has this virus, and the world needs to vaccinate and protect itself against the virus. So we will be talking with Pfizer in the coming days and with AstraZeneca to talk to them about their manufacturing process and how well they are managing so far as they increase it to smooth it out. And that will give us increased information about future supply. But right at the moment, future supply, the supply of the vaccine is secure. It's about the volume that it comes to us week on week. Next couple of weeks, the volume will be reduced. Then we expect to see it increase. A slight dip in March at this point, although that may not pan out to be the case. And into that equation, of course, goes the increasing need to make sure that we are doing the second dose, increasing in numbers, to ensure that we're giving people the second dose to complete the vaccination programme within the timescale that the clinical advice has given to us to use. So those are the fluctuations in delivery of a programme of this scale with vaccines that are new and are being newly manufactured. Safe and effective, undoubtedly, but newly manufactured. And that is why we see some fluctuations like this, but we'll continue to do that forward modelling and that planning in the knowledge that we have the infrastructure to deliver fast and at pace, high numbers, should supplies allow us to do that. Jason, I don't know if you want to add. Okay, thanks very much. Thanks, Ross. Next is Craig Payton from PA.
Thanks, Health Secretary. With case rates in the main dropping and the vaccination numbers increasing quite rapidly every day, are you able to say if this trajectory continues, will the children that are promised to go back to school on February 22nd be able to do so? And in terms of the quarantine hotels, when can we expect these rules to be finalised? They're meant to come into effect on Monday, as we know, but is there a worry that there may be an issue with compliance from people who just simply don't know what they are because of the timescale?
So just on your last point there, Craig, the rules will be finalised in time. I can't be clearer than that, I'm afraid, because the discussions are really important discussions and they need to work their way through. But everyone is very conscious of Monday and Monday's date and the rule, and are working very hard to make sure that the rules are finalised in time, not only in time for Monday, but in time for people to know and understand them. And the work will be undertaken to ensure that that happens. I know Jason will want to say a bit more about the progress in suppressing the virus. I would simply make two quick points. One, whilst the news that we are reporting is better news than we have been reporting about case numbers and numbers in ICU, it is still, those are still high case numbers, and people are dying in numbers that is a huge regret to all of us. So our approach must be a cautious one. It must be cautious, and we must take time to be sure about the progress that we're making. Which takes me to your final question before I turn to Jason, and that is that the Cabinet will meet at the start of the week and review all that information, take advice from colleagues like Jason and the Chief Medical Officer, and make a final decision next week on whether or not that planned limited reopening of education can still go ahead. And so people will know at the start of next week what the position is for the 22nd of February. Jason.
Thanks, Cabinet Secretary. So firstly, on the rules, the basic rules are clear. If you come into this country from an overseas destination, you will have to go into supported isolation for 10 days. The operational delivery of what that exactly will look like, how your meals will be delivered, and what your breaks from the room will look like, that is what we're still working out. But the basic rules are clear. If you come back, you will have to go into managed isolation for 10 days in order to protect you, your family and loved ones, and the broader population. The trajectory is a really, really difficult question. It is slow. It is still decelerating, but barely. A couple of weeks ago, I think we could say it was decelerating well. We have stalled. Not completely, but the curve is flatter than we would have hoped. And that's all down to the new variant. The new variant is harder to reduce with this level of lockdown than the old variant. We now know that scientifically around the whole country, and we can see it beginning to overtake some other countries in the last few weeks as well. To illustrate it, let me describe the admission numbers. So not the number of people who are in, the people who come in. So the pipeline into hospital. So in the last week, 624 people were admitted with COVID in the last 7 days. That compares with 875 the 7 days before. So falling, but that's still over 600 people with family and loved ones being admitted to hospital with this serious disease. And in intensive care admissions, not those who are already in, admissions, 93 in the last 7 days compared with 72 in the previous 7 days. So more people ending up in intensive care and very, very sick, some of whom will die. So this trajectory is very fragile. So the way this will work is over this weekend, I and my colleagues with the modellers, with the statisticians, with the public health leaders, will give advice to the First Minister, the Cabinet Secretary and the Cabinet, and they will decide on Monday whether schools should open, even in this limited way, a week on Monday.
Thanks very much. Dan Vevers from The Sun.
Thank you. A Freedom of Information request released today suggests that you were briefed on the findings of October's Public Health Scotland care home discharges report 5 days before it was published, and shows how officials honed in on the not statistically significant line. The report was ultimately published 15 minutes before the First Minister announced her take on the findings at this media briefing on October 28th. The FOI also shows the First Minister was given lines to take in anticipation of any questions at the briefing. There are claims today that this correspondence shows he spent, quote, almost a week plotting how to spin this report. It's quite a serious charge, given we're talking about a discharge policy that may have contributed to the deaths of thousands of people in care homes. So how would you respond to this? And secondly, just quickly, if I may, our readers and shop owners and businesses want to know when and how this lockdown ends. When will you start charting a path out of lockdown?
Okay, thanks very much, Dan. On your first point about the FOI release and the claims, absolute nonsense. We did not spend any time trying to spin anything. Remember, this is an independent report, independent of government and with academics from both Glasgow and Edinburgh University. The report says what the report says. And we have been very clear in our response to that report and very clear in what we believe should be done and how we should act going forward and the steps that we have taken over many months to try and ensure we have what is now, in effect, 7 layers of protection around care homes and the residents in care homes. Now, if people want to make political capital or attempt to make political capital out of this, then that is their prerogative, but I think it is much more serious than that. I take the safety of our residents and our staff in care homes much more seriously than that. And as to that claim, that I don't have anything more to say about it. It is nonsense. On the question of the point about businesses and others wanting to know what's the route out, and I understand completely. We all want to know that. We want to know how soon will we be able to spend time in the same room with family or friends. I understand that completely. And I really do wish I could give you a neat timeline and a neat chart. But it is not as straightforward as that. And really, I think in our heart of hearts, we all know it. We've had too many months' experience of dealing with this virus, and now with a new variant. Just heard Jason talk about what that new variant is like. It's now the dominant variant. It's the virus now in Scotland, and it is different from the one that we were dealing with coming up to a year ago. So we understand, I think all of us, that this is not straightforward. There's no binary set of rules that we can follow, no clear timeline that can be set out weeks and months in advance, because the data is so important to us in order for us as a government, a cabinet, First Minister and her cabinet, to make judgments about what is the right thing to do. But the one thing we do know for sure, all of us, is that if we ease up too quickly, then we see the case numbers rise again very fast indeed. This virus goes up fast and comes down slowly in terms of case numbers. And you need to take all of that into account and make the best judgments we can at the time when we have to make those judgments using the best information that is available to us. Jason.
I have very little to add. I can't tell you when. I can tell you how, and how is reduce the prevalence. We were still talking this afternoon. The Cabinet Secretary has just illustrated one of the hardest decisions we've had to make is funeral restrictions. I mean, nobody wants to stand here and say only have 20 people at funerals. But while the prevalence is still 800 cases a day, 112 cases per 100,000 over a 7-day period, you have to only have 20 people at funerals. So that means lots of other things are further down the line. And I can't tell you when they will reopen, but I can tell you how we get to there. And that's by every single day thinking, do I need to leave the house? Do I have to open that door? And when you're out, pretend you have the virus.
Thanks very much. Alexander Brown from the Scotsman.
Hello, Cabinet Secretary. In Scotland, couples who don't live together can meet indoors, but they cannot in England unless they live alone. What is the reasoning behind this difference? And ahead of Valentine's Day, when do you foresee single people being able to date again?
So I'm going to go straight to Jason for that, because the decisions we make, as we've said really clearly, are based on that clinical advice and the evidence that's before us. So, Jason.
So it's about judgment and choice. So we think of the pandemic in terms of 4 harms. I've talked about one harm pretty bluntly this afternoon, which is the harm from COVID. But we also talk about a second harm, which is what COVID response does to your health service. So increasing waiting times, challenges around mental illness. The third harm, which is this harm, is societal harm. What does your response to COVID do to your society? Closing schools, loneliness of older people, loneliness of younger people, and separating existing non-cohabiting couples. So when we made those choices about what colloquially known as bubbles, perhaps, where we allowed single people with kids to link up with another household, we also at that time allowed non-cohabiting couples to come together. But that means you've got 2 households together, and if one gets positive, remember, in either of those households, everybody has to isolate, so there's a cost to that decision-making. But the simple answer is it's about judgment. And we decided with the Cabinet that in our advice was that that was a risk that we should take. And every single thing that's open or allowed is a risk, let's remember. The only sure way from a public health perspective of getting to zero is lock everybody in their homes and deliver them food parcels. So we have to have some level of harm-free reduction, which is what this measure is.
Jason's, of course, absolutely right. And I think it's worth just remembering that a point about the 4 harms, we're not ignorant of the other harms that dealing with this virus in the way that we have to deal with it can cause. There are harms caused to other areas of non-COVID healthcare, of course to the economy and to wider society and people's loneliness, isolation, sense of community and so on. And all of the time, the decisions we make are trying to balance those, but with the dominant of those harms that we have to focus on because it costs lives, is what we do to suppress the virus and get it under control, whilst now we are vaccinating people at pace. As long as supplies are there, we are vaccinating people at pace for another layer of protection. But we're well cognizant, we've talked about it at these briefings many times, and when we say in the briefings that we regret saying something, as I said this morning about the situation around funerals, it's genuine. We do regret that. We know that it hurts people, we know it causes upset and anxiety, but the choices are difficult choices, and the principal choice that we have to always favour is the one that has the best chance of saving the most lives. And now to Mark McLaughlin at the Times.
Good afternoon, Health Secretary. Jason's told us many times that coronavirus is here to stay. Has the European Union's vaccine nationalism dented your enthusiasm for an independent Scotland in Europe? And if Scotland's outside the UK waiting to get into Europe, and Europe won't export vaccines in future, and the UK presumably won't give Scotland vaccines, where is Scotland going to get the next generation of COVID vaccines from?
Well, I'm not going to get into Scotland and the UK and should Scotland get into Europe. This is a COVID briefing, and I'm sure there will be plenty other opportunities to get into those kind of discussions. I had one last night and thoroughly enjoyed it. The point about future vaccine supply, though, one of the things we need to remember, of course, we have a company in Scotland that is currently working its way through trials. Scottish scientists, academics, researchers, clinical senior clinicians like Jason and others. Our scientific community is global. Our research community is global. And we're very fortunate here in Scotland to have some of the top universities in the world in a country of only just over 5 million people. So I have every confidence that Scotland, in whatever constitutional arrangement it ever happens to be in, which of course will be for the people of Scotland to decide, that Scotland will be able to secure the vaccines it needs, not only for COVID, but for all the other important vaccination programmes that we have such a good track record in achieving and vaccinating and protecting our population. Derek Healy from the Courier.
Thank you, Cabinet Secretary. I wanted to ask you about some of the variants we've seen emerge. I know AstraZeneca are working on a booster vaccine to help deal with the South Africa variant, and SAGE's Professor John Edmonds said this week the new Bristol variant may be able to reinfect those who have already been infected or vaccinated. How is that developing picture in terms of variant and possible follow-up vaccine shots being factored into the current rollout? And do you think there may be a need for a shift in the government's approach to deal with that? And also, if I can ask just very quickly, given the First Minister told people yesterday not to book holidays abroad and staycations are uncertain, what further support will be given to Scotland's travel industry?
So on your last point, then, our Finance Secretary, Ms Forbes, and our Economy Secretary, Ms Hislop, look constantly and engage constantly with sectors across the country about the support they need and how quickly we're getting it to them and what more we can do, what more might be possible for us to do. So that continues to be an ongoing discussion. And in response to some of those conversations, of course, you've seen us widen the criteria sometimes for support or introduce or top up support that's already been announced and issued. On the question of variants, I absolutely will go to Professor Leitch for this. He's the clinically qualified individual on this platform. But what I will say is that because of the work that he and his colleagues, the Chief Medical Officer, Deputy Chief Medical Officer and others do, and their connection across the UK and globally, then they are able to keep politicians like me up to date with how those variants might be emerging, what is currently being thought about them, what the scientific community are looking at and considering, and where they might reach a consensus view or not, and what that then means for my job, which is to ensure that we have the fastest and most effective vaccination programme that we possibly can that proceeds on the basis of that good clinical advice. Jason.
Yeah, so some of this pandemic is painfully predictable. And one of the things that is predictable is that the virus would mutate. Every virologist told us that would happen. And it would probably mutate to be more transmissible because that gives it an advantage. And that's what's happened. The unpredictable element is whether it will predict to make disease worse or be harder to solve with vaccines or natural immunity. And we simply don't know that yet. There is some suggestion in South Africa from the AstraZeneca trials there, but it was a really small study, that there might be a slightly less effect of the vaccine on that virus, but we simply don't know yet, and we keep it under review. For Scotland, the South African variant is very, very under control because the Kent variant, in shorthand, is overwhelming all the other variants because of its transmission. It is winning the virus race in order to be the dominant version. But it will not be the last variant. We will have others. And that's where the flu vaccine is helpful in our thinking, because every year we change the flu vaccine. The companies, loads of companies all over the world, keep up to date with what the WHO say should go in the flu vaccine. So there are clever groups of scientists who say this is what you should put in your global flu vaccine. That's exactly what will happen with COVID in time. Clever groups of scientists will say this is the version that you should use to make your vaccine for 2022 and maybe for 2023. It will probably, the vaccine we've got just now will probably give some level of protection for all the new variants, but we will just up it and make it better by those boosters. So I don't know, and nobody does, but if I had to gamble, I would say we're probably having annual COVID vaccines for some time to come.
Thank you very much. Alistair Grant now from the Herald.
Hi there, thanks very much. Just on quarantine hotels, is there any information or any kind of further details of the Managed Isolation Welfare Fund for those who can't afford the charge, and when that will be published? For example, I think the NUS has called for students who need to return to Scotland for a variety of reasons, such as for in-person teaching, to be exempt from the charge. What's the situation there? And just on funerals really quickly, I saw some reporting today which touches on criticisms of the Scottish Government issuing guidance requesting that funeral directors don't advertise the date or time of funerals. Is that new advice, and has it been issued in response to the concerns over the number of people turning up to funerals? And as these notices are often about communities marking deaths as well as just giving information about funerals, what would you say to those who maybe think that goes a step too far? Thanks.
Thanks very much. On the question of students, I heard the president of the NUS on radio yesterday talking about this very issue, and I know that colleagues elsewhere in government are talking with universities and with others about how managed isolation can be managed in the situation of overseas students and others who are coming into Scotland and need to undertake managed isolation. And I'm sure a solution to that, satisfactorily to all concerned, will be reached fairly soon. That discussion continues, as with those other discussions, but we are conscious of the concerns that students have raised. On the point about funerals, we've not banned funeral notices, so nobody should think that that is the case. What we're asking, though, is we're asking those who read funeral notices, if they are not in the group of 20 who have been invited, to please don't just turn up. That makes it very, very difficult for those who have organised a funeral and for others to manage that situation. And whilst I understand the motivation, you want to go and pay your respects and show those who have lost a close loved one that you are standing beside them, you can't literally stand beside them. And it makes it more difficult for them and for the organisers if more than 20 people turn up in that very emotional and difficult situation that they're in. So that's what we've said, that's what I said this morning, and that's what I know very many people are respecting that guidance and are doing their very best to follow it. We need to make sure that everyone does everything they can to comply with that guidance, difficult though it is, and I completely understand that. But it is important to do it because every time people come together, then the virus has an opportunity to go from one to the other. And I know that that is not what people want to see happen. Jason, do you want to say anything more? No. Okay, and our last journalist this morning is Daniel Sanderson from The Telegraph.
Thanks very much, Cabinet Secretary. Can you, just on the issue of quarantine, can you let us know, has the Border Force agreed to share information with you on where people have previously been if they're arriving on a flight into Scotland from within the common travel area? So, you know, for example, if I was to fly from New York to Dublin and then Dublin on to Glasgow, will they know that person should be taken to a quarantine hotel, or, you know, is that another loophole in this? And can you just be clear, what should someone do who has a flight booked into an English airport, who lives in Scotland on Monday? What should that person do? Should they go back to Scotland and quarantine at home, as Matt Hancock has suggested? Should they stay in England? You know, what should that person do? Okay, so I'll ask Jason to contribute to this if he's got any other points he wants to say. So everyone who is travelling into the UK, of course, internationally, has to fill in a form about where they're going and why they're coming in. And the important thing, of course, to remember is that international travel in general should not be happening. So the discussions that we're part of, the Border Force and ourselves do exchange information, have been doing that for some time, of course, before managed quarantine. So the discussions that are underway is about the degree to which that information will then be shared if the individual is arriving in Manchester or London and is then travelling on to Scotland. And that will then allow us to understand where they're going. However, we wouldn't have to do this if the UK would take a more sensible approach taken elsewhere around the world, which is to say that everyone who comes in, not red zone countries or other coloured zone countries, but everyone who comes into the United Kingdom needs to undertake managed quarantine. That is the way to deal with this straightforwardly and simply. Now, we'll keep on with those discussions. We'll keep on having those discussions with them. I had one myself last night with my own counterparts to make the case that this is a clearer, simpler, better approach and more easily understood by anyone who is travelling in to these islands. But until we win their support for that, then we have to work our way through those loopholes, doing everything we can to mitigate the consequences of those loopholes in order to protect the population of Scotland. And remember, that's the point. As people here every single day are complying with restrictions, staying at home, staying 2 metres apart, not spending the time that they desperately want to with their friends and their family and their loved ones, but abiding by all those rules, and the vast majority of people in Scotland are doing exactly that. They're doing it because all of you understand that that's what needs to happen right now to bring the case numbers down, to make it safer for everyone else, to save lives and protect our health service. Now, in return, it's our job to do everything we can to help you do that, but also to protect Scotland from the inward transmission of the virus. We learned that from the summer. All of us should have learned that from the summer. And so we keep trying, working with the UK government to convince them that our approach is the right approach, and in the meantime work through everything we need to do to mitigate where their approach weakens our capacity to protect people as much as we believe we need to.
Anna, I mean, we've been speaking to the UK government, and you know they just don't agree with your policy, and there seems to be absolutely no desire on their side to help you enforce Scottish government policy in England. So, you know, obviously you can have an honest disagreement about that, but isn't it the case that without UK government cooperation, you know, having a Scottish-only policy isn't going to work because this, you know, ring of steel the First Minister has spoken about is going to have a 96-mile hole in it?
No, I think I've already covered that. Of course, it's deeply disappointing if, as part of a family of equals, one partner isn't prepared to help the other partner enforce the policy that they think is the right policy for the people that they represent. So that is deeply disappointing, and the discussions will continue because we are, as we have always been, keen where we can to reach a four-nation approach to dealing with a virus that doesn't actually respect boundaries and borders. But in the meantime, as I have said, we will work through what the options are to mitigate where the UK government stance creates a loophole in what the Scottish government believes is exactly the right thing to do. And I have to say, that's not something that as politicians we dreamt up. It is based on clinical evidence and the experience of the country over the past summer and what happened thereafter as numbers of cases increased. So we've got a really solid foundation to make these decisions, but we need to work in a way that manages where there are loopholes in what we can deliver. Because the UK government chooses to go in a different path from us, then we need to find ways to mitigate that as far as possible. The best solution is actually for all four nations of the UK to agree that the right way to do this, as other countries have done, is to make sure that all international arrivals have to undertake managed quarantine. Jason.
So from a public health advice perspective, irrespective of the political conversations, we've had two questions today principally about new variants. You can't deal with new variants unless you deal with importation of the virus. It's as straightforward as that. You cannot deal with new variants unless you deal with importation of the virus. And that means creating safe travel. Now, what you describe as safe travel, we think that means people who aren't exempt should go into managed quarantine. So if you are coming via the common travel area and your final destination is Scotland, you will have had to have booked. It doesn't come as a surprise when you arrive. We don't take you to a hotel you weren't expecting. You have to book online for your managed quarantine. And Border Force won't have to do anything. They will just have a process by which the transportation takes you to that booked hotel. The more difficult challenge is, of course, if other parts of the common travel area don't do what we think we should do, and the Cabinet Secretary has dealt with that question.
Okay, that's us for today. Thank you very much to our journalists for joining us. Thanks to Anna, our BSL interpreter, and my thanks to Jason for joining me today as well. But most importantly, my thanks to all of you. Before we go, let me just remind you of some of the important guidance and rules at the moment. And of course, the most important rule of all for all of us is to stay at home. That's right across the country in mainland Scotland. The only reason to be leaving home are for essential purposes. That includes caring responsibilities, essential shopping and exercise. And if we do meet someone outdoors, only one person from one household. Work at home if you possibly can, and employers have a legal duty to support you in doing that. And on any occasion when we do leave home, all of us need to remember to wear face coverings when we're doing essential shopping, avoid anywhere that is busy, clean hands and hard surfaces, use 2-metre distancing, and to self-isolate and book a test if we have symptoms. All of that is what all of us are continuing to do, and I am so very grateful to every single person for that. We do it because we know staying at home and following those rules is the best way to protect ourselves, our loved ones and our communities. And we do it to keep the virus under control while the vaccination programme does its job. So please stay home, protect the NHS and save lives. Have a good weekend and a happy Valentine's Day to everyone. Thank you very much.